The Honorable and dearest judges, teachers, ladies and gentlemen, I'm Refa Rahmaddiansyah and my teammate Muhammad Zidan Amriza from Faculty of Medicine, Universitas Andalas, Indonesia. In this good occasion, we would like to show our innovative idea entitled Antibacterial Herbal Toothpaste from Gambir, Uncaria, Gambir Roxb for the treatment of gingivitis. Oral health is a very important for general health and well-being. Oral diseases such as caries and periodontitis are common throughout the world. The global burden of dental caries that is not treated for primary and permanent teeth remains relatively unchanged over the past 30 years. Acute streptococcal gingivitis has a microbiological origin and clinical features that are specific and characterized by a bright red swollen gingiva associated with pain, fever, and malaise. The current management of this disease is to give the analgesia and antibiotics according to the causative bacteria, and in more severe cases, surgical periodontal therapy can be performed. The toothpaste in the market contains fluoride that function as a prevention of dental caries. The toothpaste containing fluoride can cause side effects in the form of fluorosis or dental enamel weakening. The use of gambir as a preparation of the toothpaste is one of the efforts to explore the benefits of the gambir. Gambir catechin has an inhibitory effect on Streptococcus mutans bacteria that causes gingivitis. So the objective of this study is to find out the potential of the herbal toothpaste from the gambir catechin as a preventive approach for the streptococcal gingivitis treatment to reduce the morbidity and improving the life quality in all parts of the world, especially by utilizing the natural local treasures in Indonesia. So the problem and research method and approach. The first is problem analysis based on the phenomena that occur and the search for the ideas, the gathering information stage in the formal study of scientific literature related to the issues to be discussed. And the third, the implementation phase is in the form of the writing scientific paper based on the literature studies and analysis of the concept understood throughout the information sources. And then we're making a sample of the product or the prototype that can present the working principles of the concept that have been discussed in writing. So the material that we need in making the toothpaste is the glycerin, the MgCO3, the peppermint, the aqueous, and the 90% purified catechins from the gambir plant. Here are the materials that we need in making this product. So the preparation begins by weighing all the ingredients carefully. Then the gelling agent is made by adding MgCO3 with distilled water and then homogenizing it. Then the mass was stirred and then 90% gambir catechins were added which had been dissolved in boiled water. While stirring, add the glycerin little by little until the dough mass seems thicker. Finally, add the peppermint oil and stir until it forms a paste. Put in the bowl like this. This is the capture moments in making this product. And here are the design of the prototype, the ready-made product of Pagika. We named the product as Pagika, Pasta Gigi Catechin. And this is the product. So the gingivitis is an inflammatory condition of the gingival tissue or gum which is generally caused by bacterial infection. This inflammatory process often begins with the accumulation of a microbial biofilm that forms around the gingival tissue, also called the dental plaque or dental plate. The pathophysiology of the majority of gingivitis is related to inadequate cleaning of the oral cavity, leading to accumulation of plaque and bacteria. If left untreated, the plate accumulation can trigger an acute inflammatory response in less than a week. The patients with gingivitis can be prescribed as an antiseptic oral rinse containing chlorhexidine. In severe cases of gingivitis, oral antibiotics and anti-inflammatory drugs can be considered. So, the catechins are the main components of the gambir plant that can play a role in various medical purposes. The content of catechins in gambir is around 7 and 33%, followed by catechin kanat and another In traditional medicine, gambir plants have long been used by most people in Southeast Asia and Southern Asia to treat the various diseases, among other to treat diarrhea, gastric disease, antioxidant as prevent cancer, disorder modes, the treat burns, acne medication, and one of the ingredients for battle with chewing. Gambir is a medicinal plant that is very potential to enter the natural medicine database. Since this Muja et al. In the previous study has investigated the efficacy of the gambir as an immunomodulator, as an antibacterial, and also as an antioxidant. Apart from its antioxidant capacity, this toothpaste formulation made from the mixture of the gambir catechin also has the potential as an antibacterial in streptococcal gingivitis. Gambir catechin toothpaste contain the polyphenolic compounds that have antibacterial activity so that they can inhibit the formation of the dental plaque. Polyphenol compounds are able to prevent the bacterial addition from the pellicle dental plaque by inhibiting the activity of the glucoside transferase enzyme that causes the glucan. This is also occurred with research by Ilmiawati, which proved the catechin content of gambir in toothpaste formulation was able to reduce the dental plaque index in experimental patients. So we can conclude that periodontal disease is an infection where specific bacteria plays an important role. Periodontal is the main cause of the tooth loss in adults. This disorder begins with gingivitis, which is left untreated will result in periodontitis or infection that can destroy the teeth and the surrounding tissue. Apart from its antioxidant activity, the gambir catechin toothpaste formulation also has the potential as an antibacterial in gingivitis. The catechin compound as an antibacterial has two properties, that is being able to inhibit or the bacteriostatic and kill the bacteria, the growth of the bacteria that causes plaque on teeth, which will lead into the streptococcal gingivitis. Furthermore, we will continue this research to clinical studies as a candidate for standardized herbal toothpaste and tested by medical laboratory. Then, we have planned to develop this innovation as a to ready sell products that have protective capabilities in the prevention and the treatment of the gingivitis to obtain the Food and Drug Product certification and arrange the market analysis later. So thank you very much for the chance that given to us, and we hope that you can interest and can fund our study, save your health, and explore the nature. Thank you.